pleasure to work with you both for the last couple of months. And it's a great honor and it's a privilege to be speaking. I've been working in this field for the past more than 4 years. And it's the first time I'm able to connect with my colleagues from WHO and non-WHO workers in public health. And it's a great initiative, and I'm very proud to be a colleague of yours and to be working with you both. So before I start, and one of the main things that I'm going to be discussing is our values as public health professionals, I would like to take a moment to address the situation in Gaza, West Bank, and Lebanon from a humanitarian and public health perspective. As professionals dedicated to public health, humanitarian work, and the protection of human lives. It is impossible to overlook the tragic loss of innocent lives in these regions. Communities are suffering under the weight of violence, displacement, and complete collapse of services, healthcare, water, food, and shelter. These conditions don't just create a crisis of immeasurable proportions, they compound effects of trauma, disease outbreaks, and mental health burdens that will linger for generations. While we rightfully focus on greater issues like climate change, it's quite disheartening to see that the destruction caused by the bombs, shelling, displacement often escapes the same level of urgency. The loss of human life, whether through conflict, natural disasters, environmental degradation, should always evoke our deepest concern and action. This destruction of homes, hospitals, schools in these regions mirror destruction of hope and humanity. In such circumstances, it is imperative that we as public health professionals use our values that we've had ingrained in us to highlight the human cost of this violence and push for an equitable and just response as public health professionals. And as we engage in discussions on emergency preparedness today, I urge us all to consider the broader implications of our work, not just in natural disasters or pandemics, but in humanitarian crisis driven by man-made actions. It is our collective responsibility to respond, to bear witness, and to advocate for the health and dignity and safety of all people. So thank you, and let's begin. Hopefully the sharing of the screen can run smoothly as well. Great. So just a quick title introduction. So we'll be talking about how we can enhance leadership in emergency preparedness and lessons from the trainings that I've conducted and evaluated over the past couple of years. So just a quick introduction about what the WHO Collaborating Center for Public Health Training and Education is. We are a center of excellence in education, training, and research and consultancy. We fall under Imperial. So as you can see the flow, we fall under the Faculty of Medicine, specifically the School of Public Health and Department of Primary Care and Public Health. We've been appointed as a WHO center since 2007 in Imperial, and over decades of experience given to innovation in health systems and prevention and research and training. And there's a huge network of people that we work with and collaborators, and I am looking to expand that network, and hopefully I'll be able to connect with all of you. And I'm really glad that a lot of interest came through on this very important topic. And of course, we have a dedicated staff and led many global and regional policies, which we will go through some of them now. And I just want to focus on a very small part of our work, which is WHO CC's work in emergency preparedness and what we've done over the last couple of years. We've developed strategies and policies through research to effectively respond to health emergencies, focusing on preparedness, mitigation, and rapid response. Why am I qualified to speak with you guys on this topic? We have done a public health academy during the pandemic, COVID-19 pandemic. I will not name the country for various reasons. We delivered short courses on acute events management, emergency preparedness and response, advanced leadership and health management, and many more that you can find on our website. We've also adapted the WHO advanced training program for rapid response capacities training in different country contexts, which I will talk to you guys about in a few minutes. We've done training the trainers for emergency preparedness, training rapid response team capacities members, so members of rapid response teams. And we've done research to develop the Global Competency and Outcomes Framework with WHO Europe and the WHO headquarters for essential public health functions and services. And most recently, it's been an honor to work with Dr. Samar and Maria and her team on evaluating their WHO EMRO Leadership in Emergencies Training Program, where the number of participants so far is 546. And hopefully we'll be discussing this in the next couple of slides. So my background is very much research and education. And I've done a bit of clinical work, but I will not delve into that for this session. However, why I mention my education background, because I would like you guys to benefit from what I'm discussing today as a competency-based webinar, where I will be talking a step-by-step process on what you guys can learn from the discussion today. Hopefully, I know it's more of a lecture-based because you'll be hearing my voice mostly, but hopefully the discussion at the end will be very fruitful for you guys as well. And the unique approach that we do is capture lived experiences in our training and in our programs, and we make sure we get always the participants' perspective in any training or in any research, and not only based on theory. So we'll start with the first section of my talk, where we'll talk about what is leadership in emergencies and what do I mean by that when I talk about it. We'll start with what I mean through literature and from what I've researched and looked at over the years. The key insights of leadership in emergencies is transformational leadership, TL, so it's highly effective in emergency preparedness and response. It fosters this cohesion and high performance amongst emergency preparedness coordinators, and it emphasizes the importance of vision, passion, ethical standards, seeks to transform not only the leader, but the people that are getting trained as well, or the people that are following the leader. So it focuses on 4 dimensions. It focuses on the ideal effect. So what is the main vision, the inspirational motivation that comes with it, intellectual stimulation, and individual consideration. And we'll delve a bit deeper, which can positively impact what, in this case, when we look at vision, passion, ethical standards, and how we can transform the leader, it positively impacts the organizational commitment, the knowledge, management of the practices, employee empowerment, job satisfaction, administrative creativity, and so on and so forth. The second key insight is communication and coordination. I'm pretty sure everyone has heard about effective leadership in emergencies, how it hinges on clear communication and coordination among diverse agencies and sectors. One term that comes up in most studies is meta leadership, which connects different organizations and promotes a shared course of action and is essential for overcoming any silos that might come up because of the different agencies that we're talking about, and ensures a unified response. So just so to explain it to everyone, meta leadership has 3 components: the person himself that is leading, or herself that is leading, that focuses on self-awareness and emotional intelligence. That is a very important factor to understand the motivations, the behaviors, which inspires and guides others. The second component of meta leadership is the situation itself, where leaders need to analyze and understand the complexities of the situations and consider, of course, the perspectives and what motivates all the stakeholders involved. The third component is connectivity, where you build and leverage those connections, and they lead not just within your own organization, but across the boundaries, and fosters collaboration and unity of this effort. The third one I want to talk about, and it's one of the main ones is training and development that significantly enhances the emergency preparedness capabilities for public health leaders. And these programs improve knowledge, skills, the ability to respond effectively to any public health emergencies. And we'll talk about some specific components in a few. The fourth insight found in literature is behavioral health and psychosocial impact. This is crucial for addressing any behavioral health needs of both the survivors and the responders, of during these disasters. So it's very essential, and effectively leaders usually should ensure that accurate, understandable, and credible information is provided. And this is why one of our main goals of the WHOCC is start this discussion about health literacy and how we can improve it in all regions and countries. Another main one is collaboration and vision, which is where a compelling vision is always needed. Leaders who can inspire and mobilize teams effectively through strategies rather than relying solely on their position of power. And then we come to the last one, which is specialized needs, where leadership is crucial to ensure that vulnerable populations and their needs are addressed in these disaster planning and leadership roles. And of course, understanding how the systems can be properly managed for these specific needs. So these are the references that I'm talking about, and hopefully this is quite clear for everyone. And these resources are very helpful if you want to delve more deep into each of these main insights that we focus our trainings on. Now, going to the second section, hopefully, again, this is easy to follow for everyone. So the second section would be talking about what we base curriculum design on. And I'm pretty sure everyone would have heard of needs assessments and how learned experiences can be used. However, what we went through now, based on the insights that we got from the literature itself, we saw the discussion of vision and planning, communication, decision-making, coordination and collaboration, training drills, resilience and adaptability, and post-emergency analysis. And one thing we have in common with all these is something that we call soft skills. So we'll talk about what soft skills are in a second, because again, it's a term used a lot in our field. But the main thing you need to understand, it's this slogan that I came up with, where we train to lead and we lead to save. And I always say this, that our job as public health professionals is to serve the population. So what are these soft skills that we discussed, or combines all these insights from literature? The ability to teach and provide constructive feedback, understand who we're talking to or who we're trying to engage with when we're communicating any kind of findings. And just like what I'm doing now, I know there's a diverse audience. That's why I tend to explain each aspect of what I'm talking about. So there is no missing or gap that I can create, which can lead into more misinformation or an infodemic. And I'll leave that for people who dedicate their lives to researching that. So again, understanding the target audience as a leader, as a member of any group or organization, it's very important to understand how you can communicate any findings that you collect. Clear and reassuring communication, effective communication, it's a whole field, and it's a whole course that we do. And it's a very important one to make sure that what you're delivering is received as you delivered it. So you need to make sure that there's no gaps or any kind of thing or borders that stop that clear communication. Emotional intelligence. This is why I got my emotional intelligence practitioner certification, just to make sure how you can weigh different options quickly, how to make situational analysis easier for you, looking at different stakeholders, looking at different participants, different students, different leaders, how you can absorb their different differences or any kind of trait that they might have and be able to use it effectively in what you're trying to achieve. Ability to listen is a huge one. A lot of us, a lot of different cultures do not know how to listen. And I can say that because I'm Arab, so bear with me. Interpersonal skills and how to build relationships and foster teamwork is very essential as a soft skill. Open to change. There's a lot of resistance to change. We always discuss it in my team, how we can do this behavioral change, what can incite a behavioral change, how we can improve health, can we promote health, how can we change the health professionals' attitudes on how to speak with patients, to speak with trainees, to speak with students. Those are all things that need, just like a muscle, you need to train these soft skills and thorough and honest analysis. In the research world, we know how easy it is to falsify information, to falsify data. And it goes back to the traits of what a leader is in emergencies and in any kind of health field. Our traits or our values should not change. Yes, there is resilience. Solving skills is very essential as well. And again, it needs to be trained if you don't have it. Empathy, situational awareness, delegation, and integrity, and our integrity, and what I mentioned at the start of my talk. So these key traits, again, you can say them, you can say you have them, but as I mentioned, as you go out and try to build a muscle, you need to build these traits. And these traits, just like a muscle, if you don't keep training it, it will deflate. So you can say now that you are empathetic of what's going on in the world. However, if you don't act on it and practice this empathy to become a more proactive action, then I don't believe that that trait falls in the right place for you as a leader. So using everything I just mentioned from literature to, yes, look at the traits, look at the soft skills we're talking about that you need to build a leader and build a curriculum, or trying to train, not just train as a program, but training your team members on how to do a certain task, on how to do a certain project. It doesn't have to be as specific as emergencies. However, we're going to focus now on what it can be done in emergency training situations. Always context specific, needs-based training. So it should be based on, as I mentioned, the target audience, local influences. Those do a lot when you're trying to train for emergencies, especially when they talk in a different language, or they rely on influencing factors like religious leaders, like social media influencers. Those play a huge role in influencing people's decision-making and response. And in emergency situations, we usually use those leaders, like religious leaders or social media influencers, to get a message across, just like what should have been done in COVID during the pandemic, and to battle this kind of misinformation. Context and culture is very important, and I will talk a bit more about it in a second. And our health needs, population health needs, is very context specific. Different countries need different things. They have different health services. Populations are burdened with different diseases, communicable and non-communicable diseases. So it's very context specific on any kind of curriculum you're trying to design. And technical skills usually are standardized across all regions through WHO. WHO has incredible resources that are very specific, straight to the point. You can use them, yes, but the essential thing is how to adapt it to the country context. And that's what we've been doing for the past couple of years. So the importance of non-technical skills, which are some of the soft skills that we discussed: leadership, communication, situational awareness, decision-making. These are critical for rapid response teams in public health emergencies. Simulation-based training is one of the main things that I want to talk about. These were very well received in most of our trainings. because it gives different roles, different tasks, and it helps them imagine the situation that they are in. And we'll talk about what the participants thought in a second as well. And it combines both the technical and non-technical skills. And you as leaders or you as trainers, you will be looking at those competencies that we base all our curriculum on. These competencies done by WHO are a guide for both the trainers and the trainees to understand what are the essential skills needed to finish a task or finish a role or be deployed somewhere. Tailored training strategies, as I mentioned, in a team, you have diverse and different roles, any team in different organizations. You should be able to capture the attention of every single person in that team when you're doing rapid response capacities trainings. Different people come from different backgrounds, so you need to make sure you have something for each role or each individual, from epidemiology, for example, to prevention control, to any kind of virologist that's on your team. You need to be able to deliver something for each of these roles in an emergency situation. Adaptive leadership training is very important to improve these competencies in leadership, public speaking, knowing how to receive feedback and do your own evaluation. Self-evaluation is very important. And of course, either any kind of team member needs to be able to do that within their own resources and time. Assessment and refinement of any kind of non-technical skill. This is done by continuous assessment and refinement of the training program. Um, Also, this is where a lot of participant interaction is very important, where you use a lot of surveys. We'll talk in a bit about what we've done in different countries, where we send out pre and post tests to test any receive any information from their end to measure their competencies and be able to measure their competencies after a certain training, which is very effective. And it allows us to first assess our materials and assess the trainers that's doing the training, their own competencies as well. So this is a packed slide. Hopefully we'll get through it in a smooth way. But I talked about how we can adapt a global guideline to local context, and I think everyone needs to do it at some point. So even if you have a training you see online that you want to do for your team, your small team of 6, this needs to be done based on, number one, understanding what your needs are in the team. In an emergency situation, you'll need to know what your population needs are. And this is just acknowledging those unique challenges that each population has and the resources available that you have as well. And this is where a lot of local public health agencies, you can go to NGOs to be able to understand what the human resources that you have and what are the needs that you need to cover. Integrating best practices is another one. Integrating something like risk communication, best practices into any kind of local health system is essential. This kind of connection and communication is essential, and some countries have adopted military healthcare protocols in civilian emergencies for that reason. Community preparedness, I can talk about household preparedness, which is just understanding a bit more what each household is capable of doing in cases of emergencies. However, how to strengthen local preparedness involves engaging individuals and communities in disaster risk reduction activities. And of course, fostering the social networks that I just talked about, where you look at the community and what support can be given at what time. Also, training and exercises, again, I know this is a repeat, but it's just to understand that even previous disaster experiences and training can significantly improve preparedness levels. So you guys don't need to invent the wheel, as my colleague Rachel always says. You don't need to reinvent the wheel. It's just if something's already done or there's lessons to be learned from it. If there's data look at the data, look at what reports are published in emergency situations and just build on that. Look at the gaps, do a gap analysis and build on that. You do not need to do something from scratch. Some cases, some countries, yes, we had to do things from scratch. Leadership and communication, I've mentioned this as well. However, it is very fundamental for this to be ingrained in each person in public health, because again, there's a huge gap in our voices on social media, and at all media platforms actually. And there's a lot of things being said that are false, and we need this overcoming of what stigma some people might have on getting online and talking about something, any political or cultural contexts that are unique to certain emergencies. However, as I mentioned, during pandemics, this is very essential as well, to start taking a step towards leading with your voice. And I mentioned frameworks. They describe key characteristics for disaster preparedness. WHO has a big one that was published in March 2024, which we worked on as a research team. But the main thing that we need to focus on as public health professionals is how we can integrate this into the academic world to make sure people that are studying public health understand what these frameworks are, what these competencies are, what's missing now. And I'm trying my best to make sure that everyone understands that they need to do this with their own team, to understand what the gaps are in your teams and your specific context, to understand where you need more trainings in, and then go to Dr. Samad, for example, and let her know where these gaps are. Guidelines for emergency preparedness, as I mentioned, and I can share all the frameworks that we've been using. So implementing these emergency training from experience and from the literature, from my perspective, I just try to summarize it as much as I can. Resource management training is very essential, trying to understand how you can improve team performance, what resources you have, where teamwork is really essential, how you can manage tasks, who does what in certain relationships, and how communications work between those different tasks is very essential. Combined training modalities, of course, simulation training, as I mentioned, is very essential. Different people, different adults, and adult learning is a field by itself. However, adult learning tells us one thing, that each person has their own pace and learning style. So you need to understand that people sometimes use visual aids to understand. Some people enjoy reading the books. Some people enjoy listening to the lectures or long podcasts to learn. Others learn by doing. So it's about mixing those training capacities, even in your own meetings, or if you're trying to get a skill out of your own team members. Combining different training modalities or training modes could enhance the outcome of what you're trying to reach. Theory-informed training programs, as I mentioned a lot, is the competency-based training that we base all our trainings on. We try our best to do so, and I tried my best to do it in this webinar as well, just to make sure that someone takes something from theory into practice. And I just used the bus there to capture people's attention that dropped off for a bit. However, effective training design elements is essential as well. This face-to-face delivery, I know a lot of trainings now are online and virtual, and I wish this was more of a workshop that I can hear your opinions and kind of tackle any gaps identified individually. However, different things require different training elements that should be implemented. The content, attendance policy, duration of a training, how much focus you have from certain individuals, and sociologists do this all the time, where they start assessing how much focus we have. Different colors capture different people's attention. So these are the kinds of things that we as trainers are trained in order to capture people's attentions and enhance the training outcome. Now, I don't know how I am on time, but these next two sections are quick. So this is a first case study from implementing rapid response capacities trainings in a country, again, I will not name, let's call it country X. So the first thing I want to talk about is the key findings that we've done after training the members and training the leaders themselves. So there was positive feedback, of course, because they valued clear objectives, relevant content, practical simulation training. As I mentioned, that was a huge, crucial part of the success of our program. However, skills drills and looking at simulation or how to give different role play roles in your skill drills were well received, and it was very important to reinforce that kind of learning as a practical element. Planning, the logistic sides of things is very essential as well to be able to get all the trainers together in order to give them this program. Resource allocation as well is necessary in order to include all the training materials needed. And when we're talking about emergencies, it's the bed itself from a hospital perspective needs to be there when you're trying to train someone. So it was very essential to plan properly. Some challenges that we encountered, some logistical issues. I put language barriers there as well because from a logistics perspective, we had to translate a lot of the materials, and it took a lot of time from a preparing perspective. Trainee nominations were very slow in this country, and we needed to do a lot of follow-up and try to our best to fit in the time that was given to us. Time management was another issue. We tried our best to adjust break times to emphasize how much they need to be leaders in that moment in order for us to do our work properly. Another kind of challenge was because different people in these rapid response capacities are from different background knowledges, and they have different, they've been working in the field for a lot of years, so they might have forgot certain things that we needed to focus on. So this kind of quick gap analysis that we had to do as trainers helped us kind of shift around in the moment with the materials and focus a bit more on the gaps that we have identified as facilitators, which and then caused us to have multiple meetings before these trainings with the facilitators as well, or the trainers from that country itself. So we can teach them a bit more about our training background. And because we're all trained at Imperial on how to teach or how to train in certain programs, that was very essential. And we had to do it before every session. So some lessons learned from this case study: cultural sensitivity. I will not dwell on a lot on this because I've said it multiple times, but looking at the local needs, looking at what you need to do to enhance the adaptation of these materials for order people to absorb the material is very essential. And leadership development, the soft skills that we talked about were essential for the program's success, and this is fundamental and should be fundamental for emergency response effectiveness. Evaluation happened in multiple methods. As I mentioned before, we had pre-post tests, and then we had participants' feedback. And by participants, I do not just mean the people getting trained. We had the facilitators, the organizers, everyone give us feedback day by day. And we've managed to train over 270 members of emergency preparedness. So it was a really nice project that we were on, and hopefully it taught us all something. Section 4, I'll come to the evaluation of the leadership program we're doing now with WHO EMRO and Dr. Samar and Maria and her team. So some key insights and lessons learned so far. We did not finish it yet, but hopefully we'll be finishing it very soon. So just a quick insight on what we know. There was a total of 546 from 92 different countries and 7 regions that were trained between 2019 and 2023. The aim of this project or this research study that we're doing at WHOCC is to assess the effectiveness of the Leadership and Emergencies Training Program in improving emergency response. So it's commendable for multiple reasons, and I don't think I've discussed this with Dr. Samar yet. However, because an outside entity is doing the evaluation, number one, it reduces bias from an evaluation standpoint. we're looking at the training program from a third person perspective. So it's us looking at WHO EMRO's training program, which encourages innovation from a different perspective. Key findings so far, I did not list all of them for a lot of reasons. However, the main things that I wanted to mention, that the training had significant or very significant, as the participants mentioned, impact on the leadership soft skills from around 61% of the participants. More than 45% felt that the training improved their ability to manage stress and resilience, which is a huge percentage. More collaboration and networking efforts are needed, and hopefully that will be done. Practical activities and simulation exercises were what resonated the most with the participants in this leadership program. And leaders in this field have busy schedules, and we know this. So training for leaders should be flexible and efficient enough for the leaders to participate in this, and hopefully more leaders do join this leadership training program. What is the importance of this project? Number one, we're measuring the program effectiveness to get concrete evidence on what we discussed throughout this whole talk. And this can allow us to improve all the leadership training programs. So it's not just this program. Hopefully the evaluation that we're doing will enhance all leadership programs. Demonstrate value to stakeholders, from funders to partner organizations to collaborators and potential participants. This will give evidence-based career progression for one, and skill enhancement, number two. Enhance participant engagement. This ownership encourages participants to be more up to date with what's going on in the field, number one, and this alumni network that will end up after this project is very good for participant engagement, and it enhances this collaboration that we've been discussing from the start. Promote accountability and transparency, which is the core value in our work, which strengthens the program's reputation within the emergency and preparedness response community. So what have we discussed today? The importance of leadership in emergencies from experience and from literature, how to design curriculums, lessons learned from the rapid response capacities trainings that we've done, and the key insights from evaluating the training program with WHO EMRO. Thank you so much. Do check us out on our website. And if one of our team members is in the chat, maybe they can drop it in the chat box. And if you have any questions, any concerns or insights, please email me whenever, or Dr. Samad or Maria with any questions you may have. And I believe we have a time for discussion. I hope we do. Maria, straight to you.
Thank you, Celine. Thank you so much for your presentation. And I'm very excited for the report to come out very soon, hopefully. And well, we have now time for questions. So the floor is open. So for all the participants, please raise your hand and I will call you out. And I see Eleni already. She has her hand raised. Go ahead, please.
Thank you. Thank you very much for this presentation, Celine. And I would only I'm very interested in the importance of soft skills. And I would like to clarify something, please. I believe it was the slide number 5 or so, where you demonstrated the bubbles around the center bubble with the title, what are the soft skills or so, and you were naming a few. And then the next slide to follow, you were presenting some key traits for leadership, like empathy and problem solving, I believe. And I was wondering, what was the difference? What was meant to be the difference between these two slides? For me, the key traits are also, the soft skills that one could have included in one of these bubbles of the first slide. Or some of the bubbles of the first slide could also actually indeed appear as key traits of the other slide that followed. Can you help me clarify this? Because I'm sure there is an answer. I'm so much curious to hear it. Thank you.
No, no worries, no worries. There is definitely a reason why I put them in two different slides. Key traits should be inherent and core characteristics that define a person's behavior and personality. So that's what we mean by traits. So it's more stable over time, and they are considered innate sometimes. Some people have them from their backgrounds or how they were brought up. So those are what traits are: honesty, resilience, empathy, decisiveness. You'll hear a lot of those. And in a lot of psychological training or personal development training, they tell you to respond to a lot of questionnaires that assess those traits that you have. Now, when we go to soft skills, they're more learned abilities. So when we talk about effective interpersonal interactions, how often they're transferable across roles and the industry that you're in, soft skills are usually developed and honed through experience and practice. So it's, again, improved over time, as I mentioned, time and time again. These are the examples of communication, teamwork, problem solving, time management, emotional intelligence. These skills are usually more practical and often applied in professional and social contexts to enhance collaboration and productivity.
Brilliant. Actually, so yeah, I mean, this is very important for someone to realize this kind of differentiation, in particular when informing CBT activities and their content, for instance, not only in emergency, but regularly. There are some things that can be taught and some maybe not. And actually, I thought that I found interesting that active listening is supposed to be something that can be taught, correct? Mm-hmm.
Yes, yes.
Okay.
You should. That is an incredible observation. Yes, active listening should be taught, and all leaders should be taught that. And sadly, that is not the case at the moment.
Perfect. May I come with another question as well? Is it possible?
Yes, absolutely.
Thank you very much. So from the learnings of the project you presented, you mentioned that one of the findings was that you could improve the collaborating and networking. Can you elaborate a little bit on that in the sense of how did you realize that this should happen? Was it a direct feedback from the participants? Was it an indirect realization in some way? I mean, this is a very relevant finding, and it is very interesting how you tested on it. I mean, and realized that it could do better.
Thank you so much, Eleni, for that question. So the evaluation comprised of multiple parts. We had to review documents on what they've actually done in the leadership training program Dr. Samar has done. We had to do a survey with the participants, and we chose a few people for interviews. So the findings were, by responding to a few questions that were specifically about collaboration and networking, we found the survey pointed out that the collaboration and networking was a bit weak. And in the interviews, I was capable of analyzing it a bit more and asking more questions to the participants, where they pointed out that there wasn't that communication aspect throughout during and after the training program. They weren't able to connect as much as they wanted to. There was a connection element, but the connection wasn't as much as they wanted to. And it's important to realize that, yes, we're focusing on the training program as is. However, this collaboration and networking is very important in emergencies. And I believe Dr. Samad is working on it. And this webinar itself should be evident in that these changes that are happening in the emergency world, where connection and collaboration across different regions is the core, I believe, of these emergencies training. And another thing that I wanted to mention, based on your question, they did also mention that, yes, there was also an improvement in their career progression, and they wanted to be able to go back and talk to different regions so they can learn more about their lived experiences from different emergencies, because they realized in these training programs from different regions that they were exposed to different things. And that communication that happened during the training program was essential for them to learn a lot more. So the people from the WHO headquarters, which was the 7th region, sorry, I said that there are 6 WHO regions and the 7th was the headquarters. So people from the headquarters, WHO headquarters, were not exposed to the same emergencies as the ones from WHO Afro and WHO EMRO. So they learned a lot from that connection. And I think that connection is essential to that continuity and enhancement of the training program.
Oh, this is amazing. And maybe if I'm allowed to make a comment, I realize this has to be a subject of 3 levels, like a macro level, a meso level, and micro level. It's a very important factor.
Yeah.
Thank you so much.
Thank you. Thank you, Eleni. These are great questions. Thank you so much. Dr. Samad, did you have something to say?
Thank you, Celine. Thank you.
No worries.
Just to complement what you have said, Celine, as well as to elaborate more in the networking and collaboration. Since we are providing trainings in leadership and emergencies, we are creating the networking and collaboration opportunities. We are putting people from 6 regions in one room and asking them to talk to each other and to work with each other and to collaborate with each other. But a problem people they should also focus on, the responsibility is shared. It means it's not just the provider, it's the recipient. We are all adults, we are all leaders. So it's also the responsibility of the recipient to build upon the network opportunity we created for them, as well as the collaboration we created with them for them. I mean, they are allowed to talk to their colleagues from other regions. They are allowed to talk to people from other organizations. They are allowed to work in collaboration with people. By the end of the day, we are building leaders, which means we are trying to help you to identify your leadership potential, but then you have to fly at some point. And that's what we are trying to push people to do. Please fly, because by the end of the day, we cannot walk you through the whole steps until from age of 30, for example, or 25 until 70. That's very impossible. No one will do that. Leadership is not a position. I'm always saying it. Leadership is a skill, and people, they should realize that. Leadership is a skill, so you have to build up on that. And that's very interesting, Celine, you talked about it, because that's, I feel, is not it's a good feedback, but I think also it's our responsibility to explain to people. It's the responsibility to continue this journey. I don't want to take more time from other participants. We might have other questions. Thank you. Over to you, Celine.
Thank you, Dr. Samad. And it's very important, just like this webinar, it shows how many people are willing to engage. So I believe you provided a platform for people to start acting on those traits that they've learned or they want to learn. Thank you. Any other questions?
We encourage people to also type in the chat if they want to, maybe questions.
And I believe I can share the slides. I just need to remove a few information that hasn't been published yet. And I'll share the slides with Maria, which can share it, I believe, with everyone that registered. Thank you, Maria. And I'll share the PDF version. And hopefully, if you guys have any questions, do reach out to any of us. And I'll make sure to get back to you.
Maybe, Celine, I need just to complement something, since we are talking about rapid response capacities and working in the field. So when we are training when we train our leaders, emergency responders and leaders, we are making sure to strengthen their dynamic leadership capacities, because working in emergency field, it needs dynamic leadership skills. So, and it's part of your responsibility while you are in the field, not just to deliver the response, but to deal as a leader, and to think, okay, in this situation, I'm dealing with a team and there's a conflict or with beneficiaries. As a leader, what should I do? Please just remind yourself all the time in the field as a potential leader what I should do. That's something important. And leadership, it's a dynamic process. All the time it needs fuel. So the more you learn, the more strong you be, and the more potential and impactful you will be. Thank you. Over.
Thank you. I believe Miss Eleni, Dr. Eleni.
Yes. Thank you. I'm taking advantage of others being silent, so I
No
will
worries.
ask the third question. The importance to me now that occupies something that occupies my mind is the differentiation between, for instance, residents or mature consultants in the workforce of medics. When we are talking about collaboration, interprofessional collaboration, maybe it is another thing against the general term of teamwork, right? And have you ever had any, maybe this is a very, very, very strong detail on things and doesn't make difference, but considering some barriers because of authority or because of responsibility, level and expertise level. Have you thought indeed maybe to differentiate between the concept of being a good teamwork player and the concept of being a good interprofessional communicator? Let's put it this way.
Yes, we have, and that's, thank you again for a lovely question. So that's what we've done exactly with the WHO framework that we published in March 2024. Hopefully I'll share that link with you guys after this. This is exactly what we did. We looked at the competency-based skills that you need to follow the public health functions that are now 12, and we followed it with services that you can provide. Plus, we provided behaviors and different behaviors that you can do. And what you mentioned beautifully was the different levels of the workforce. So what we did in that framework as well, we divided the public health workforce, which includes doctors from different specialties, policymakers from different areas, and public health workers, the wider range of public health workers as well. And we divided them into tiers, and we specified the word teamwork. We defined it, and we put specific competencies, and we marked it against in a matrix against the certain tier level that they're at based on the workforce or the skill level that they should be at in that specific competency that is going back to public health or global health. So it's a really good framework, and I encourage you to do it. But yes, we've definitely looked at the different levels of teamwork, what we mean by teamwork, how you can engage in teamwork, and how we can train people in teamwork. Hope that answered the question.
Yes, I will go into depth on this framework. Thank you very much.
No worries, thank you. And we have it on our website. I believe Rachel shared it as well. We have all that detailed information about that framework, and it's a really good one. Hamid or Hamid?
Thank you. Thanks a lot. Yes, it was very productive. Thanks to you, Maria, Ellen, and Summer. It was good discussion. I'm just asking about the stress management because people teach us that we should go for soft skill everything, but the stress management as a team leader, it's very important because it's not, when you are in stress as a leader, so you will transform the stress to the team. So already emergencies and rapid response, we are in stress. And then when I see all these frameworks, some of them may not apply in some contexts. So mindset, sometimes mentally we are in stress, obsessive with those frameworks, whether to apply or not, because we feel like this is very important to, critical, but sometimes it does not apply. So all these stresses, it combines and it distracts, our attention, energies, everything. So if you could a little more, maybe the panel elaborate on stress management.
Absolutely. So I know it's a big term. I know it's a big term, and I know a lot of things that I've mentioned, I did not give it justice because of the time that I have. And as I mentioned, I wish this was a bigger session with more workshop elements that I can talk you through what I mean by each thing that I mentioned. But the first thing that you will need to identify as a leader is that level of self-awareness. And I believe that you do have it because you mentioned your own stress. So you are already there in acknowledging and identifying the stress that is already there, that self-awareness is there. The next thing would be doing is understanding what triggers that stress. And in a stressful situation, of course, but you get to a point where you've seen multiple things, you might get used to certain levels of stress. And that's human nature, that's evolution, that's adaptability, etc. You need to be able to share these tasks that you have as a leader to be able to delegate. And one of the things I mentioned was delegation. Because you as a leader cannot hold everything. We don't expect you to hold everything. And I hope that is the case across all organizations. You should be able to delegate responsibilities for a capable team member, not only reducing your own burden, but that empowers your team. So you've done two things in one when you start delegating. So you've helped yourself and then helped your own team on stepping up to the task that you gave them. And another thing that is very essential when we talk about decision making and talking about stress management and all of the delegation aspects, this is where you start learning prioritization, where high impact tasks are those that need or have immediate deadlines and the biggest risk. So this is risk management. And again, this is something that you can get trained on how you have been trained on, which allows you to set boundaries, which is another thing, and avoid overextending yourself because that won't help anyone in any situation. And communicating openly with your team is very essential because someone else from a different level or a different department or someone that yourself are leading have the same stress that you have. Yes, so the more you talk about it openly and maintain that transparency, which I've mentioned, without transferring the stress, the open communication about the challenges can foster understanding, and speaking out about stress in any situation, I'm not talking about just emergencies, usually gives us a third perspective and reduces. So if you're calm and solution oriented under stress, it will encourage your team to adopt the same principles that you have. Another aspect that I mentioned a lot is emotional intelligence, and I do encourage a lot of people to train in emotional intelligence, read up about emotional intelligence. Yes, frameworks are there, and there's a lot of frameworks, and that's why we combine them into one to make sure people are able to read through it and implement it. And hopefully we'll be doing that a lot more in our papers and the research that we do, and in these webinars as well, teaching us how to implement the framework or implement the theory that we have. Self-care is another one. Hopefully everyone is mindful about their own practices, and taking short breaks when they need it. And support should be always there in any organization. From WHO onwards, there is support. There is a team culture somewhere, and then you need to reach out to it, because if you don't reach out to it, no one's going to realize what you're going through as an individual. You can't expect other people to understand what you're going through without voicing it out. And this in itself, I know I said a lot in these few seconds. However, you need to understand that these are the bases of fostering a collaborative environment. And if you need any support or any help, I am here. I know Dr. Summer's there. I know Maria's there. If you need any help, if you need any support, if you need any advice, please do reach out and let us know what is needed from our end in order to help you out. I hope I answered your question in a nice way.
Yeah, thank you so much. It was very
No
comprehensive.
worries. Thank you. Thank you.
Shukran.
Thank you so much, Celine, for the very informative session and very engaging session. Thank you, our leaders, our current leaders, future leaders, and potential leaders. Thank you for joining us. Keep it up. Keep the spirit up. Do the networking, do the collaboration, and walk the talk. That's the best way to market leadership. please join us in 2 weeks. In 2 weeks, we will have a very interesting session with the Deputy Director of Bill and Melinda Gates, Dr. Valerie Pimo. She's another amazing and unique speaker, and she will be joining us in 2 weeks. Thank you, everyone. Thank you, Celine, Rachel, WHO Collaborating Center at Imperial College for this time and effort has been done to make this successful and doable. I have to say thank you to the soldier behind the scenes. She's besides me, Maria. So she has done a great job, and she has been following up and working on this nonstop with Imperial College. So thank you to Maria. Maria, she will make sure to share the slides after this through email, through our WhatsApp group for the emergency leaders, through LinkedIn. Please, if you have any questions or comments or collaboration opportunities, reach out to Maria, Celine, or myself, and we would be happy to help and to collaborate. Thank you, and happy weekend for people in our region, and see you all soon.
Thank you, everyone.
Thank you. Bye.